Hi everyone, welcome to Microbiology Infection Control channel. Today we are learning about hand hygiene. So what is hand hygiene, what is hand wash and what is hand rub? So why it's important? Why hand hygiene is important? Thousands of people die every day around the world from infections acquired while receiving healthcare. Hands are the main pathways of germ transmission during healthcare, from patient to patient, from doctor to patient, and from patient to doctor. So, hand hygiene is therefore the most important measure to avoid transmission of harmful germs and prevent healthcare associated infections. Now, what are the various importance of hand hygiene? Why it's important? So it's the most common mode of transmission, most important factor in preventing spread of organism, means nosocomial infection or hospital acquired infection, so or cross infection. It prevented by hand hygiene. It is also responsible for reduction of number of infections, decreases patient length of stay in the hospital, it decreases use of resources and also reduces number of deaths. Now, hand washing reduces hospital acquired infection, nosocomial infection or healthcare associated infection. So, hospital associated infections kill more person than road traffic accidents. So, it's very important to prevent hospital associated infection. So, wash or their hands or hand hygiene should be performed by any healthcare worker, caregiver, or person involved in direct or indirect patient care needs to be concerned about hand hygiene and should be able to perform it correctly and at the right time. When to clean your hands? So these are the 5 movements of hand. So first movement is before touching a patient. Second is before clean or aseptic procedure. Third, after body fluid exposure risk. Fourth, after touching a patient. And fifth, after touching patient surroundings. So, these moments are very important. 5 moments. Remember these 5 moments: before touching a patient, before clean procedure, after body fluid exposure, after touching a patient, and after touching patient surrounding. How to clean your hands? So there are 2 methods. One is hand rubbing, second is hand washing. So hand rubbing, it is done with the help of alcohol based hand rub. Whereas hand washing, it is done with the help of soap and water. So when hands are not visibly soiled, then we have to do hand rubbing. And when hands are visibly dirty, contaminated by blood or body fluids, we have to do hand washing. And after potential exposure to spore forming organism, before eating, after going to toilet, before and after shift of the duty, we have to do hand washing with soap and water. So alcohol based hand rubs benefits. So what are their benefits? Alcohol based hand rubs benefits are they require less time, more accessible, reduces bacterial counts on hands easily, improves skin conditions. Now how to do hand rub? So this hand rub requires only 20 to 30 seconds. So what we have to do, first step is apply a palmful of the product in a cupped hand covering all the surface. Second is rub hands palm to palm. Then third is right palm over left dorsum with interlaced finger and vice versa. Means left palm over the right dorsum with interlaced fingers. Then next is palm to palm with fingers interlaced. Then next it's back of the finger to opposing palms with fingers interlocked. The next is rotational rubbing of the left thumb clasped in the right palm and rotational rubbing of the right thumb clasped in the left palm. The next is rotational rubbing backward forward with clasped finger of right hand in left palm and rotational rubbing backward forward with clasped finger of left hand in right palm. And then we have to dry hands, and now the hands, they are safe. Hand hygiene and medical glove use. The use of gloves does not replace the need for cleaning your hands. Hand hygiene must be performed when appropriate, regardless of the indications for glove use. Remove gloves to perform hand hygiene when an indication occurs while wearing gloves. Discard gloves after each task and clean your hands. Why? Because gloves may carry germs. Wear gloves only when indicated according to standard and contact precautions. Now, what about the fingernails and artificial nails? Natural fingertips should be kept 1/4 inch in the length. Artificial nails should not be worn while taking care of the patient. So now for infection control, the team works. And the take home message is, please wash your hands